Hello, my name is Jamie Elvidge. I'm a scientific advisor at the National Institute for Health and Care Excellence, or NICE. We are the health technology assessment organisation for England and Wales in the UK. I'm really pleased to talk to you today about some work that we undertook as part of the HTX project 1 or 2 years ago. When the COVID pandemic hit, we took the opportunity to understand or try to understand what are the key challenges posed by COVID-19 for organisations like NICE, for health technology assessment processes which seek to make independent decisions about whether treatments, interventions, tests should be reimbursed by health systems or not. So what challenges did COVID-19 pose? And particularly we wanted to focus on tests and treatments for COVID-19. So what were the immediate issues that agencies like NICE were facing regarding how do we assess these treatments in this really strange, urgent situation? And how does this differ to our day-to-day practices or our business as usual? First, I think it's useful to talk about health technology assessment, or HTA, as an ideal. What would we really like to see at NICE from a health technology, from any assessment that we do? So first up, we'd like to be presented with really high quality, randomized evidence that a new intervention or a test or a pharmaceutical is clinically effective. We want to be sure and have some confidence that the intervention, that we know how good the intervention is compared with current practice, compared with the most appropriate alternative. And we'd ideally like the evidence to be generalizable. So in our case, we'd like that to be in UK patients or very locally appropriate patients. We'd also like to see a robust estimate of the value for money that the intervention might offer. So kind of a core principle of most HTA agencies in Europe is that they'll consider not only the clinical effectiveness of an intervention, but also the cost effectiveness. If an intervention is clinically effective, it's correct that a health system pays more for it, but there are limits on that, and most health systems in Europe have a fixed budget. We can't spend an infinite amount of money on new interventions, even if they are good. So we'd have some robust estimate of just what is the cost effectiveness, the value for money of this new intervention. We'd also have really good detailed input from a variety of stakeholders. So away from these two quantitative elements of clinical effectiveness and cost effectiveness, we'd also want to hear from patients, from citizens, from clinicians, the clinicians who may be providing this treatment, and from industry partners. We'd really want to hear those views as part of the process. And lastly, we'd also want to consider anything else that hasn't been captured in those first three boxes. So are there any other relevant factors at play for this particular assessment, this particular intervention? So is it a really severe disease area? Are there no current treatment options for this patient group? Are there health inequalities at play here that might be addressed by a new treatment? So we'd hope, in an ideal world, we'd have all of these things, and they kind of feed into a deliberative decision-making process, a HTA process, and a result of that would be that we, as a HTA body like NICE, would produce an evidence-based reimbursement decision or recommendation about the treatment. So we can weigh all this up and say, yes, this treatment appears to be effective, good value for money, and valuable to stakeholders, and it should be used. Or on the flip side, no, we firmly believe that this is not a good option for the health system. We don't think it should be used. Ultimately, the aim is for that process to lead to evidence-based, effective, safe, and financially sustainable healthcare. So that's the ideal situation. And back in 2011, when we engaged with organisations like NICE on this, we wanted to understand how far is COVID-19 from that ideal. So we conducted an online survey of representatives of health technology assessment organisations in April 2021. We reached out to 47 organisations, and we followed the survey up with a workshop, a roundtable workshop in May. Our goal was to identify what HTA representatives perceived or had already experienced as challenges when they came to assess a treatment for COVID-19 or a diagnostic test for the infection. What challenges did they think they were going to hit, or what challenges were they already experiencing when trying to make reimbursement decisions about these technologies? We conducted quite a thorough thematic review of everything we heard. So the survey was entirely composed of free text responses. We wanted to hear what they had to say. There were no tick boxes, no multiple choice questions. We wanted to hear from in their own words, what are the challenges? And so those survey responses alongside the workshop, we took together everything we heard and pulled out key themes. So key themes of challenges posed by COVID-19. And it's those things that I'd like to speak to you as part of this presentation. And we also think it's now actually you'll notice that this was conducted in 2021, 2 years ago, and it's possibly now an opportune time to consider, are the challenges that we identified 2 years ago still relevant today? Are they still present in the context of COVID? Or are there other things that we can learn about the challenges faced then going forward? So very briefly, it was quite a simple survey. We asked HTA representatives in terms of challenges in assessing tests and treatments for COVID. What challenges are you facing, or do you think you'll face when it comes to assessing clinical effectiveness? The same question for when it comes to assessing cost effectiveness. And is there anything else not neatly categorized as a quantitative estimate of clinical and cost effectiveness? Is there anything else that you think will be a particular challenge when it comes to taking a view about treatments for COVID-19? We got 21 completed survey responses from HTA organisations that are shaded in blue, and those shaded in dark blue are the 11 agencies that joined us for the virtual workshop to discuss the results in a bit more detail. So as you can see, we've got nice representation certainly from Europe, but also some global agencies as well. We identified from this, we received around 200 free text responses from the survey, and these were discussed in much more detail at the workshop. And we pulled out 5 broad themes. Every item that we heard, everything that was discussed, we think would fit into one of these 5 themes, and they were challenges relating to assessing whether a COVID-19 treatment is clinically effective, challenges when taking a view on whether they offer value for money. So they're quite neat, clinical effectiveness, cost effectiveness assessment categories. But there were some others. There were 3 other issues that came out really prominently. These were issues relating to actually making a reimbursement decision about these medicines. So once you've got your clinical effectiveness estimate and you've assessed the cost effectiveness, translating that into a decision, there were some particular nuances during COVID-19 that made that step quite hard. There were some issues that we've categorized as political issues, and I'll talk about those in some more detail. And then practical issues, these are very much around the context of the time, working during COVID, what challenges did that pose for HTA organisations? And again, we'll talk about those in a bit of detail. And as part of that, we actually identified 17 sort of big sub-themes, which you can see here, and I'll talk about each of those in turn in the next video.